Well, welcome. I'm Dr. Michael Furlong to Ask Dr. Furlong Live. I'm here with a crew of Furlong Vision Correction. I'm going to introduce them and we're going to talk a little bit about what it's like to navigate through the idea of having your eyes lasered to get rid of your glasses and contacts, and how that pathway goes and what it's involved in all of that. To my very far left is Dr. Mona Sane. Welcome, Dr. Sane. Dr. Sane and I are the two LASIK surgeons in the practice. To my immediate left is Julia. She's one of our patient counselors. And second over is Doug, and he's another one of our patient counselors. We have 5 in our practice, and patient counselors are staff members that help educate and navigate our patients through the process of what they may be interested in coming in and learning about. So welcome all of you to Ask Dr. Furlong Live, and we want to talk a little bit about what it's like when we have a patient who comes up with the idea, whether it's because their spouse just had LASIK done, or they've just been thinking about it, or they've just lost their 3rd pair of glasses in the last year and want to investigate having that problem alleviated, what's involved with that. So let's start with Julia. So Julia, you've been a patient counselor here for almost 4 years. Tell us a little bit about what it's like when patients call in our office and say, I want to learn more about LASIK. What do you tell them?
Well, first when I take the phone call, I want to discuss to them, kind of figure out where they heard about us and kind of get some information. We like to kind of network with local optometrists, and we want to kind of find out how we can best take care of them after their surgery as well. So then we're looking to see what they're looking for in general, if they wear glasses or contacts, if they've ever tried monovision, so different aspects of it. And then we'll kind of help them schedule an appointment. They can either do it with us on the phone, they can do it online at our website at furlongvision.com. We'll discuss kind of the length of the overall appointment time. They'll get to meet the surgeon as well as confirm their candidacy at that appointment.
So the first thing that usually comes up is, am I a candidate, right? So without actually having a patient come into our office and doing some measurements, we really don't know, because not everybody can do laser eye surgery. There are limitations on the technology, and some people were just born with eyes that are not capable of correcting. So we want to know if they're a candidate, and that involves coming in. Our initial appointment we don't actually charge for. We want you to come in and see if you're a candidate, and what Julia was mentioning is asking some screening questions on the phone just to make sure that those are in line with what we can take care of, and then you come in for this appointment. How long is that first appointment typically?
The first appointment can range really anywhere between 30 minutes to 45 minutes, depending on how many questions they have, because we want to make sure we can answer them all.
Okay, great, excellent. And then after that appointment, what is generally discussed? If you have a patient and we talk and they meet the doctor and they say, yeah, it looks like you'd be a great candidate for advanced all laser LASIK, what's the next step for them?
Next is really finding out how soon they want to schedule. We do have an additional appointment that will be needed before surgery. At that appointment, they will need to be out of any contact lenses for a certain length of time, and then the surgery can be a week after that appointment. Pretty fast.
So yeah, usually the lead time doesn't take too long. It's more complex if a patient's wearing, contact lenses that are either specialty lenses or, has a more complicated schedule. But we do these procedures weekly, so our availability is just based on what patient's availability is, and we try to work out a schedule that works well for them. Dr. Sane, when you see a patient at that initial appointment and you look at their information and you determine, hey, it looks like you'd be a great candidate, what kind of questions do you get, and then what kind of questions do you have to answer versus maybe one of our counselors?
Sure, that's a great question. So the first time I see the patients is at their screening appointment, when we determine if they are a good candidate for LASIK. And I look at what their vision is, what kind of a prescription they have, how high of a prescription it is. And we also do a bunch of tests on the front of the eye, on the cornea, to determine the candidacy. The typical questions I get from patients is it going to be a painful procedure? How long is it going to take? And what is the downtime? Will I be able to drive the next day? Do I need a driver? And things like that. So those are the common questions that I get, and it's pretty easy to answer. The surgery takes about 15 minutes for both the eyes. It's painless surgery because we give you lots of numbing drops. You do feel a little bit of pressure. Your vision might fluctuate during surgery, but that's as uncomfortable as it gets during surgery. My next question is for Doug. Any particular concerns that the patients have about surgery? We already talked about a few of them. But any particular questions that they ask about what things they can and cannot do after surgery?
Of course, yeah, there's quite a few things that we talk about that you can and cannot do after surgery. Especially, we want to make sure that we eliminate any type of infections is the main thing we look for. So, no water immersions is something we definitely want you not to do. We don't want you working out right after surgery. You don't want sweat getting in your eyes, basically. And we want to make sure that everything is basically healing is properly after surgery. So we want to make sure you come to do a couple of post-op either at our office or the optometrist office that you'll be co-managing with.
Okay, and typically what medications are the patients on?
Yeah, so we do two different medications for two different surgeries, LASIK and PRK. We use an antibiotic and a steroid drop to make sure we can eliminate the risk of infections. And then, of course, for PRK, we want to make sure we give an anti-inflammatory as well to kind of help with the healing process.
Cool. So Julia, if you have a patient that says, okay, I travel a lot for work, I hate wearing my contacts on the airplane, I lose them, and now I'm in another city and I don't have my corrective lenses, and I want to do this as soon as possible. What kind of time frame or what kind of schedule do you need to put together for them? How long do they need to be in town to get the surgery done and to have adequate follow-up before they're able to kind of resume their busy life?
Well, there's a few things that we could make it move a lot faster than normal, but the normal time is typically we need them to be out of their contacts. The sooner they can be out of their contacts, a lot faster we can kind of move forward with surgery. They need to be out of their contacts for soft contacts for a full week. That way we can get their eye back into its natural shape, so it's not going to alter their end results. Then we can really do surgery the very next week on kind of the normal procedure plan. Then we bring them back for a one-day follow-up, and then we tell them we want them to stay local for the first week. That way, in the event they have any surprises, we can bring them in to evaluate those.
And surprises, by that what we mean is anything that doesn't go as planned. And with LASIK surgery, which is the most common procedure that is done here, what I tell patients is the day after surgery you're likely going to be able to drive fine and see clearly, and you're back to your normal routine in a day or two. So around here, most of our LASIK days tend to be Fridays. Patients like that extra day or two over the weekend, and they routinely go back to work on Monday, and that's pretty much the general pathway as patients go through as far as healing goes. So if they have surgery on a Friday, they're back to work on Monday. Now, not everybody can have LASIK, so can you talk a little bit about what other procedures can be done for those that aren't LASIK eligible, Dr. Sane?
Sure. So the patients who are not eligible for LASIK could be those who have a very high prescription, which is probably out of the range of what our LASIK equipment allows, or their corneas are too thin to be considered safe for this procedure, or they have extremely dry eyes. So in these patients, there are a couple of other great options that we can offer them. One of them is called ICL, which stands for implantable Collamer lens. This is similar to a lens that goes inside the eye, and it stays in between your natural lens and the colored part of your eye. So we want to make sure that your eye is good for that surgery, but the quality of vision after this surgery is comparable to HD quality television. This is one of the options for patients who are between 21 and 40 or 45 years of age. For patients who are more mature than that, we have another option called refractive lens exchange or clear lens exchange. This is similar to a cataract surgery where we remove your lens before it has developed into a cataract and then replace it with an artificial lens that helps in improving your vision at distance and even at near. And with this, it helps in reducing or eliminating the need for glasses. So these are two great options that we have for patients who don't qualify for LASIK.
And as everybody gets older, one of the things that will happen is your up-close vision becomes a little bit of a strain, and sometimes we get questions like, well, I saw that there was this really famous person that you did LASIK surgery on, and I saw him on TV and he's wearing glasses as he coaches football. What's up with that? I said, well, as we get older, our near vision starts to be affected. And one of the things that Dr. Sane just mentioned is during the lens replacement surgery, which is really ideal for patients over 45 or 50 as we get older, and older, is that we can use specialty lenses as we do that procedure inside your eye that help you see things both far and close. Whereas with LASIK surgery, I had LASIK when I was 33. And what happens is when you get into your late 40s or so, the near vision becomes a struggle, and you have to go to the drugstore and buy those kind of really attractive looking reading glasses, which are fine, they work well, but it's just one of those things that happens as we get a little bit older. So there are multiple options for patients as we age, because that can be a technology that may work well. Is there anything, as counselors, that you tell patients that they'll never be able to do the rest of their lives after surgery? Are they burning any bridges?
I don't think so, because I had LASIK about 4 or 5 years ago, and I had not had to stop anything I normally do. I don't tell any patients that getting LASIK will stop you or prevent you from doing anything in the future. There are, of course, some limitations of getting hit physically in the eye, but anything else other than that, you're pretty much good to go.
So when's the last time you went bungee jumping?
Well, I don't go bungee jumping, but I can go bungee jumping if I want to.
That's my point, is he could go bungee jumping if he wanted to. Did you scuba dive recently?
No, I have not. I did, though, right after the surgery, and I was completely fine coming back up. Even on flights, completely other elevation, still fine there as well.
Yeah, usually if we have any limitations, it's short term. We tell patients they shouldn't swim for a couple of weeks after surgery. Showering is fine, so there's very few limitations that are much more beyond a week or two after the procedure. Julia, anything you tell patients? What are some of the questions you might get that are unusual or you've never heard before that you sometimes have to go and ask the doctors about?
Well, the biggest question is, can I drive after surgery or after they've healed? And my thing is, if they could drive beforehand, they could drive after, after they've healed. For LASIK and PRK, we do want them to have a driver from surgery. But after that, it's really, they're fine to do it. We don't have any, we have weird questions every day.
So did you ever get the one, can I play the piano after surgery?
We get that a lot, yes.
But how do you answer that one?
And if you could play it before,
There's the one.
play
That's
it
right.
after.
Yeah, you still got to take lessons if you're not a piano player.
Likewise, if you can draw beautifully before, you'll be able to do that afterwards. For our patients who have refractive lens exchange, we do always kind of want to discuss the near vision takes a little bit longer to come into focus. So sometimes they're supplementing with reading glasses in the beginning, but as they're healing, they don't need them, so which is nice.
Excellent, yeah, and one of the questions around here, especially in the winter, we're in Silicon Valley, right in San Jose, so we're mostly Sharks fans around here, and I tell patients, hey, you could go the next day after LASIK and go watch a Sharks game. But the one question I got recently was, well, what if I'm an LA Kings fan? And I said, well, then you got to wait a week. You got a minimum of a week. Do we have any LA Kings fans here? Just
No.
checking. Just making sure. Okay. Well, really, Doug?
Well, I'm in shark territory right now. Don't want to offend anybody, so I'm just going to stay quiet for right now.
Right answer.
Well, we have a couple of minutes. We'll open it up for some questions, and then we would like, if you're watching us live and you'd like to submit a question, please go ahead and do so. I think we might have a question or two that we can take now.
Here's one from Adam. What kind of technology does Furlong Vision Correction use for measuring and the surgery? For measuring your eyes?
Would you like to take that?
Yeah, sure.
Dr. Sane?
So we use all state-of-the-art equipment over here. We use two different kinds of equipments. The first one we use to measure the front of the eye or the cornea is called a topolizer. And this device, it measures thousands of points on your cornea. And using the data from these points, it will give you a map or information about the shape of your cornea. And from this information, we see if there are any imperfections in your cornea. And these can be treated with a technique called topography guided LASIK. That is for the diagnostic part of it. Then comes the surgery day, and we use two kinds of lasers. We use only lasers over here. We don't use any sharp blades. The first laser is called the FS200, and it's the fastest laser that is available for doing one part of the surgery. It just takes about 6 seconds for that laser time. The second equipment is called EX500. It all sounds very fancy. This is also one of the fastest laser equipments. And the actual laser time is just about 1.4 seconds for 1 unit of prescription or 1 unit of diopter that you have. So it's really, really fast, and it makes the surgery very tolerable, quick, easy, and comfortable compared to the other laser machines.
What we like, my favorite is the whole surgery is less than 5 minutes per eye. Average about 18 to 20 seconds under the first laser, and then a few minutes under the second one. So you can really do anything for 10 minutes. So
Yeah, 10 minutes is that's very accurate. Is it just takes about 10 minutes for both eyes. You're not under there for very long, and we walk you through each step of the procedure. And patients are frequently amazed that when we're done, they say, "Is that really it? Are we done? Done?" And I say, "Yeah, we're all done." And then they get to go home and rest the rest of that day. We'll take another question.
Do you have some financing options?
Who would like to take that of our
Yeah,
counselors?
we actually work with a company called Care Credit, and we have a financing option through them to allow split payments or payments over a couple of months, up to, I believe, 24 months that we can do. And we give you other options on top of that as well, where you can even go do a loan for up to about 60 months.
Excellent.
That's great.
Well, I think the key thing that we wanted to bring up today is to talk just a little bit about what is involved in finding out if LASIK is right for you, and LASIK being the most popular surgery, but knowing that there are other procedures that are also an option if LASIK isn't right for you, and we'll let you know that when you come in for your appointment. That first appointment, there's no cost, there's no obligation. Come in, it's free, you'll see if you're a candidate, you talk to one of our counselors, you meet one of our doctors, and you get to find out first and foremost if that's right for you. And then if you decide to move forward, then we'll talk you through all of that as well. You can either do that by calling our number, our office number, which is 800-573-1010. Best way to figure that out is just go to our website too. It has our numbers on there. If you go to furlongvision.com, you can also actually book that appointment directly from our website just to see if you qualify, and that's really the first step. So I wanted to thank Dr. Sane, Doug, and Julia for joining us today. Thank you very much for your expertise, your wit, and go Sharks!